everyone. Hello, clients, financial planners, CPAs, case managers, social workers, prospects. Welcome to Emerald Medicare's open enrollment webinar. It's so nice to have you all here today. I am so excited to be able to present the material that I have prepared with the hard work of my wonderful team. As you can see on the screen right now, this is the team that supports you all year long. We've got 2,000 clients in 30 states. We work all year long in support of all of you, making sure that we are able to provide the kinds of answers, insights, perspective, information that is important in this industry. This is a unique time of the year. It's also a unique transition to a year of big change. So this is annual enrollment. This is the time of the year when people are certainly looking at their plans objectively, hopefully with a broker, to be able to assess whether these plans that they're in right now with Medicare are the right plans for them. We take a lot of pride in what we do. We work hard to service all of you and make sure that we get back to you as quickly as we can. But this is a very hectic time. And so I'm going to spend the next hour or more covering a lot of different topics within Medicare, some of which you may know already. And for some of you, it may be a refresher. For many of you, a lot of the topics here will be new for 2025 that I will cover. If anyone has any questions at all, please go to the chat, whether it's my chat or Michelle's chat. She will be monitoring it all evening long. So she will be available. And if there's any follow-up that's needed, we will certainly do that as well. This webinar will be available after the fact. It is being recorded. So for anyone who wants to hear it again or send it to a friend, I'm happy to provide that information. So just recently, I was at the local community college, the continuing education class, delivering a presentation on Medicare. I've been around CPAs, financial planners, geriatric care managers, medical offices, and also I'm doing a panel for Westchester Community College. I also have a local radio show where I talk about Medicare. So I love what I do. Our staff is passionate about what we do. And with all that said, I'm going to start. So Mark Brownstein, again, for those of you who haven't met me or who do know me, I have built my career in training in healthcare, over 30 years or more of experience. But I really am an advisor to many different folks that support seniors, whether it be individuals or independent living facilities, planners, HR professionals, veterans. I love talking about this subject. I probably do about 40 presentations a year. I served as the president for the Financial Planning Association of Hudson Valley, and I've been a board member of FPA Connecticut and actually been to many chapters around the area, CPA chapters as well, case manager chapters as well. But I've done so many of these workshops for truly over 4,000 seniors and over 2,000 trusted advisors. And for that, I'm proud. I'm the sole independent resource for the local healthcare system here. And I say independent because independent means that I'm unbiased. Our team is unbiased. We're always going to do what's in your best interest. I'm very active in my community. I'm on a number of boards, and I'm really proud of the work that I do in the community that I live and all communities that want to listen to me. So people, I believe, shout from the rooftop. They are confused about Medicare. They want to understand Part A, Part B, Part C, Part D, eyeglass coverage, dental coverage, deductibles, penalties. They have questions. Yes, a lot of the questions we hear are the same, but everyone's situation is a little bit different. And I think that's what's important for you all to understand, is that everyone's situation is different. And that's what we really take pride in trying to explain the uniquenesses of your situation as it relates to what your options are for Medicare. Healthcare costs are important to everybody. People I've talked to as financial planners and CPAs, they know they are always having the conversation about healthcare costs with their clients. It's becoming more and more important and more costly, but also dental concerns. 47% of all people in America actually don't have dental coverage, and I will certainly cover dental as a part of this presentation, but it is a concern. But some statistics for all of you. The average cost of healthcare in America for everyone of all ages is $11,000 per year. $4.5 trillion is spent on healthcare in the United States, which really eclipses the gross national product of many third world countries. But what's interesting is that 50% of all medical costs in America are for pre-diabetic, insulin care, and medications. That's a very important piece of information. Also, poverty and racism account for about 60% of all healthcare costs in America. So the carrier's real focus is on positive outcomes for all people in both of those categories. 63% of people aged 65 and above truly consider healthcare to be their number one concern. But most new and even existing enrollees they worry that they'll get this important Medicare decision wrong. And it's important to use a reliable broker for that. So of the things that people spend money on over age 65, certainly housing is a big piece of it, but certainly healthcare is as well. And so you can see that percentage there is fairly significant. Social Security, I think, just announced a small increase for 2025, but the average annual cost of living increase over the last 30 years has been 2.3%. But the Part B premium, which I'll talk about, the average has been 5%. So that's coming out of either a Social Security check or it's coming out of your actual cash flow. But health insurance is really different for everyone. And I say it's different for everyone because everyone has different doctors, different medications, and a different budget. So as people approach 65 or retirement, there are options that they have to decide on. When they're working, they have some group options, but not nearly as many as when decides to transition to Medicare. But it's important if one is on a group plan or being offered retirement coverage to look at what options that's being offered. Very often I'll ask for a benefit summary to see what kind of benefits are being offered, to compare those benefits, the cost of them, maybe the cost for the spouse or a child as it relates to Medicare and comparing it to Medicare. But to compare those costs, to look at if there's any savings is really an important part of this, is making sure you understand your current plan, which includes copays, deductibles, and out-of-pocket maximums. All plans have that. And if you're in good health, you may not have seen all of those, but certainly Medicare has those features, and it's important to understand those numbers. But when people are retiring, they're looking at that important transition to a retirement Medicare or retirement medical, whatever the case may be. So there are many people who have great coverage that they're being offered in retirement, but not all retirement plans are the same. Whether a state or federal or a large company, that analysis does need to take place. But the supplemental plans, which again I'll cover later, vary by state. And many of these advantage plans or prescription drug plans vary by county. But each year, like this time of the year, this is the time to evaluate the coverage, to ensure that it's the best fit for your current budget and health. So let's go back a little bit. Let's look at 2023 for Medicare, because we're going to talk a lot about 2025, but let's look at some of the changes. In 2023, an insulin cost cap was implemented, and it saved a lot of people a lot of money. Now that insulin cost cap is at $35 a month for most medications of that kind. This is essential for people managing diabetes to have that lower cost. Also, in 2023, there was free recommended vaccines that allow people to get those kinds of vaccines like shingles and pneumonia under their Part D coverage. 2024, the year we're in now, they expanded the eligibility for Part D extra help program. Right now, for extra help or the resources or income, for a couple, it's a little over 30,000. For a single person, it's a little over 22,000. That's expanded from previous years, so more people qualify. But clearly, you've heard about the negotiated drug prices. And that's really what's creating opportunity and chaos in this Medicare market, because the negotiation of prices is really what is driving a lot of the impact of the changes that are going on in today's marketplace. So some of these negotiated prices will take effect in 2025, but a good majority of them will not take effect until 2026. So for those folks who aren't on Medicare, which could be some of you, I'll make this quick, but collecting Social Security at age 65, you're automatically going to get your Part A and Part B. If you're already working for a company that's larger than 20 employees, and have good coverage that you like, you would want to reject this Part B because you're going to get charged off of your Social Security check for this Part B premium. But if you're unemployed or self-employed or working for a company of less than 20 employees, you need to, and in fact must, get Part A and Part B. But if you're not collecting Social Security at age 65, which many people are not, they're working, then it's not automatic. Most people, 75% of the people actually apply for Medicare Part A. I'll talk about it in a bit, but it's premium free. You can have Part A. The only reason why you wouldn't get Part A is if you have what's called an HSA or a health savings account. But signing up for Part B is really based on your employment and the company size. Again, if the company is greater than 20 employees, you can defer Part B. You can get Part A. A lot of people feel pressure to get Part A because they're afraid of this penalty. The penalty only applies for the Part B portion, not for the Part A portion. So again, the size of the company and your employment status matters. So what is Part A? Part A is the inpatient hospital care, the skilled nursing, hospice. 35 hours a week of home health for people who are homebound. It's generally premium free. If you or your spouse has worked for 40 quarters or 10 years, it's premium free, which is why people get it. Part B, on the other hand, is not premium free. And this is where a lot of the conversations that we get are about when to apply for Part B. But Part B is about preventative services. It's about your doctors, your specialists, anything that's outpatient, some of the infusion, some of the dementia preventative services, diagnostic labs, durable medical equipment, all of that is Part B. Part A and Part B is 80% coverage and does not include drug coverage. That would be a standalone component. But Medicare, to surprise of many, does not cover everything. It doesn't cover routine dental. It doesn't cover 24-hour day care at home. And some of these other things like nutritional supplies, acupuncture, hearing aids, personal care. Some of these things are handled through an Advantage plan. Some of these are handled through long-term care insurance. So Medicare, original Medicare, does not cover these pieces. So what are the enrollment periods? The enrollment periods are, first of all, the initial enrollment period. This is the 7-month window that people who are turning 65 always seem to reflect on, because they're told or getting mail or phone calls that they need to do something or they'll get penalized. But again, it's only for people who are unemployed, self-employed, who are working for a company of less than 20 employees. Other than that, this initial enrollment period doesn't really apply, but people get Part A because they feel like that gets them started and in the system. So that's the initial enrollment period. The annual enrollment period is essentially now. October 1st, we're just beginning to see all of the plans that are being offered throughout the country. But it's October 15th through December 7th that we can actually sign someone up for a new plan for the new calendar year. The open enrollment period is a very unique time of the year. This is a time of the year when people who actually have what's called an Advantage plan can actually change to another Advantage plan during that time frame. It happens often in the medical offices that I work with when patients are coming to their office and they're realizing that maybe the doctor they want to see isn't covered under that plan. They have until March 31st to be able to change up to April 1st. But you can also change from an Advantage plan to Original Medicare. And so during this time frame, it's still busy, not as busy, but it's still a period of time that people do take advantage of this not very marketed period of time. The special enrollment is really an area where we see all the time because people who are working past the age of 65 and are losing their employer health group coverage, they have a special enrollment. It could be any time of the year. People often feel like it has to be during this time of the year. If someone's retiring in June, then they can get their Medicare coverage starting in July. I say contact us 3 months before you retire, 3 months before you turn 65, or 3 months before you move, just to make sure you're doing it right. But if you're moving out of state or out of county, then you have a special enrollment. If you have Medicare and Medicaid, you actually have another special enrollment. But with all the hurricanes, the fires, all of the things that are going on and flooding that's going on, FEMA puts in special enrollments all the time that allows people to make some changes to their plans. When someone comes to us mid-year, we do our best to find in their county a special enrollment that allows us to help them. So there are 4 choices. It's really this simple, folks. When you have Medicare, you may wind up staying on your employer group plan or your retiree plan. But in order to do that, it's really important for us to look at your benefits summary. It's often available online or through your HR department, and really look and review at the premiums for yourself, your spouse, and or your child. But look at the copays, the deductibles, and coinsurance, just to compare them to what Medicare offers. Original Medicare, that's another option. It's just 80% coverage. So people are at risk for the entire 20% of any service that's being rendered. So there's exposure of 20%, and it does not include a prescription drug coverage. I talked earlier about what isn't covered under Original Medicare, but the reason why people like Original Medicare is they can go to any doctor they want anywhere in the country that takes Medicare. But again, they have that 20% exposure. The Advantage plans are very popular, more popular than you probably realize, because a lot of the corporations, a lot of the school districts are actually moving people onto Advantage plans, and they're quite good. They are PPOs or HMOs. They include a drug plan at no additional cost, but yes, there are copays, and you can use it in and out of network in most cases for a PPO, and not necessarily for an HMO. These are very low premiums in the world of Medicare. They could be no premium, 0, could be 25, it could be 45, but it's low premium. Again, includes the prescription drug plans, but it also has things like dental and eyeglass coverage, sometimes over the counter, sometimes acupuncture, gym membership. And so these are some of the changes that are going on for 2025. Option number 4 here is this supplement, Medigap. These are the best plans in America. These prices range in a place like South Carolina, other places that are $75, $100 a month, up to $400 or more a month in the New York area. So these plans are the best plans. Again, you can go to any doctor that takes Medicare. It's Original Medicare, but this does not include a prescription drug plan. So these are plans that need to be looked at, considered. And again, some of the changes that are going on will impact the pricing on these, but these are peace of mind plans. So folks, These are the four choices. If you have an employer group plan, it's important to review the benefit summary. Look at the details of the plan. Look at your utilization on this health plan to see how much you're using it, how close are you coming to your deductible and out-of-pocket maximum. Does Medicare make sense? There's no crystal ball. On the other hand, looking at what your costs have been over the last few years and looking at your premium and other costs might be a good way to sort of evaluate it. Is it more cost effective? Of course, it depends on your situation, short or long term. If someone is actually working past the age of 65 and they have Part A, they need to have two forms signed. One is a verification of coverage from the HR department that one works. So here we have the form that needs to be filled out and essentially saying that you had credible coverage. If it's the employee that's going on to Medicare, the employee is under both applicant and employee. If in fact it's a spouse, the applicant is the spouse. But these are very simple forms, and we help by faxing this form to your local Social Security office. This is the other form. This is a request for the Part B. So with your Medicare number on the bottom, you'll see that it has a remarks section. In that remarks section, we will write in for you, or you'll write in the effective date for Part B. So the effective date for Part B may be December 1st. We write in the remarks section requesting an effective date for Part B for December 1st. We fax these in. We ask that you confirm that they received the fax, and then we move forward with a plan. For people who have had higher income, this is an incredibly valuable opportunity. We have helped hundreds of people with this area. So if people on a tax return from 2 years prior have earned less than $103,000 as a single, as a married, filing jointly under 206, the cost for Part B is $174.70. It's going to inch up a little bit in 2025. But if the income from 2 years prior was higher than that, you can see how high this Part B premium goes. And then there's also a small Part D income adjustment. So this is important. It's a part of every conversation I have with people to make sure they understand what the government is charging to simply get Part B and Part D. But there's good news. The good news is that there is what's called a life-changing event form. If you newly married, divorced, death of a spouse, work stoppage, work reduction, you can file this form as an estimate for your current year. So if you retired March of 2025, your payroll, your income has dropped, and you are not getting the same kind of income in the rest of the year, you fill out this form with an estimate. It doesn't have to be exact, but you fill out with an estimate of what it is that you think your adjusted gross income will be, and the government will adjust your Part B and Part D. Again, we help people with this every single day, and people are incredibly grateful. We have educated and helped so many financial planner and CPA clients in making sure that they understand that this is of value to their clients. So again, Medicare Part C and D, it's a bundle. Low premiums. Maximum out of pocket in 2024 is $8,850. The only way you can get that high is if you have multiple hospital stays or multiple surgeries. Each hospital stay or surgery can cost you between $1,000 and $2,000. So that's the high limit. It's going up over $9,000 to 2025. That's on Advantage plans, but they are a network. And so, especially in the New York area and in some other states, healthy boomers without chronic conditions look at these plans. And even now in 2025, looking at the changes, people are going to look at these types of plans even more than they had before. So on the Advantage side, there's PPO and HMO. Okay. The HMO, you need a primary care. They're lower premiums. You may need a referral, generally no. And the cost of the out-of-network is more expensive. So there's generally lower copays on these. The PPO, you can go outside the network, but you pay a higher copay. Members pay more for those services, and they're a larger network with more flexibility. So HMOs get a little bit more benefits on the dental and the hearing and the prescriptions. The PPOs get a little bit less benefits, but you actually have access to more out-of-network doctors, maybe at a little bit higher copay, but you have access to them. So the work that our team does, again, our wonderful, stupendous team here at Emerald Medicare does is we review your doctors, and we make sure that the doctors that you have are in the network. You can see this is just 4 out of many carriers that we check out. And again, we're sharing this information with you. We're running your meds to help you make a determination on what's best for you. So 2025, this is information currently that exists within one of the counties here in New York. You can see that Aetna, Cigna, and AARP are 3 plans. You can only show 3 plans at a time. But again, this is after looking at the doctors. So we look at your doctors, we see that in this case, let's say that the medications are the right price, and all of your doctors are covered with these particular carriers. We're looking at these plans to see what are some of the benefits that are in these plans and what are the costs. So I'll point out to you a few things. The health deductible, $1,000 for Aetna, $500 for Cigna, nothing for AARP United Healthcare. What does that annual deductible mean? For Cigna, it's anything. For Aetna, it's essentially hospitalization and surgery. So that's the annual deductible. You can see the drug deductible. For Aetna, it's $590. For Cigna, it's $0. For AARP, it's $570. These drug deductibles are for brand named medications. You can see that the maximum is now $93.50 in network, but on the Cigna plan, it's $7,900. You can see that the out-of-network maximum out of pocket varies as well, from $11,500 for Cigna to $14,000 for the others. They all have prescription coverage for eyeglasses. They have a little bit of dental, a little bit of hearing, and you can see there where the X marks and the check marks are. So this is the kind of conversation that occurs. Now, some of these plans have changed a little bit since 2024, and these changes are very subtle. For those people who are on any type of plan, including a prescription drug plan, the carrier either sent you an email or a hard mailing on the changes that were coming for the new year. So it's an annual notice of change that actually comes to you that is important for you to look at. But many people don't. And so they call us and we help them understand what the changes are for their plans. So this is the Advantage plans in 2025. Again, all of these plans are slightly different from the plans of last year. This is United Healthcare's plan, happens to be Rockland County. Last year, this premium was $0. Now it's $25. Makes a big impact for the carrier, but that's what they decided to do. Now, in this area and in many areas around the country, carriers have reduced the number of options that are available. In this particular county, this particular carrier went from 4 options to 1. Okay, they've streamlined it. United Healthcare is a big company. They raised their premiums, but that's what they decided they needed to do to make a profit. So something to point out here is the hospitalization. The hospitalization, inpatient hospital, is $275 copay for the first 4 days, and then $0 after that for an unlimited number of days. So that's their number. Skilled nursing, often a conversation that we have with people. It's generally up to 20 days that there's no cost. Days 21 through 100, which comes up often, is $203 a day. So these are just aspects of the plan that are worth reviewing. This is what's called a dual plan, which is Medicare and Medicaid. These plans are richer, but people have to be on Medicaid as well in order to actually utilize this. In this case, skilled nursing up through 100 days. Okay. In some of the cases, they have a Part B rebate. Their medical deductible is zero. Their maximum out of pocket, there is no maximum out of pocket. So these plans, again, for people on both Medicare and Medicaid. Here's Aetna's plan, okay? Aetna, again, with $1,000 deductible. But if you look to the middle column, that premium is $49. It's $49. And if you look down a little further, you see that the primary care doctor visit, it goes from $0 to $5. The specialist, $35 or $40. The outpatient hospital, you're talking about inpatient of $375 a day for the first 6, $390. So the variability within these plans are subtle. These are hard decisions to make. And the good news, especially on these types of plans, is that this is a year-to-year decision. And so that's why people are in touch with us, making sure they're on the right plan, sharing with us their doctors and their medications. Here's a little bit more information. There's x-rays of $35, $40. You see the routine eye exam is covered here. There's $200 worth of eyeglass coverage that's there. There's a routine eye exam. And for hearing aids, they each cover between $0 and $1,700. And the copays really are based on the technology. You can see on the very bottom that physical therapy and speech therapy varies in cost as well. So the thing about the Advantage plans is you pay as you go, but your premiums are very low. You're in a network, and as long as your doctors are in the network, then many people like these plans a lot. So on these MedAdvantage plans, CMS, which is the Center for Medicare and Medicaid Services, is really trying to look at the consumer experience differently, because the Advantage plans have come under criticism, as is Original Medicare, for deceptive marketing. I think you can all understand how much mail you get, how many TV ads you see, and it's misleading in many cases. But there's wasteful overpayments also by Medicare. Some of it is at the layer of the people who are doing the billing. So, the government is trying to oversee this, but CMS is really looking to have the oversight. One of the things I'll talk about in a bit is the mental health services that they're increasing. They really want people to review their Advantage plans, but they're also looking at the issue of denials. One of the reasons why people don't like Advantage plans is that they are concerned about having procedures denied. And so that's being addressed by the government in terms of being able to sort of address that and hasten the approval process. Supervision of marketing practices. Again, we essentially compete against all of this marketing. And in our case, you get the same company each time, the same people who service you. When you're speaking to an insurance company, you can get very different people every time. But these plans are also required to have cultural and linguistic services available to help people who speak all kinds of languages. So they are looking at stricter marketing rules. So they're trying to prohibit these plans, again, these MedAdvantage plans, from airing the ads that mention benefits that are not available in the viewers' areas. These are national ads. These are not necessarily local ads. So they're trying to restrict that, monitor that. There's also misleading the viewers into thinking that they're contacting a government agency. I'm sure all of you have seen mail that looks very official. Again, Seniors sometimes get scammed. We hear from adult children often that their parent, their loved one has changed their plan and they just answered a phone call and it all sounded so good. And then they realize that everything has changed or they lost some of the coverage that they thought they had. What I alluded to earlier was around prior authorization. This process needs to change for sure. And the Med Advantage plans have taken a big hit on the responsiveness around prior authorizations. It's been about 14 days. That's a long time. They're trying to make it so that it's within 7 days. And so they plan to evaluate these prior authorization policies, especially in the vulnerable populations, because it's important that these results are made public on the websites. Again, often people are adverse to Advantage plans, often for this reason. People are comfortable in a network. They've been in a network with their group plan. But when it comes to these denials or prior authorization delays, it really does impact people getting appointments until things are authorized. So the other thing that's really interesting to me is that there's mid-year notification that is being, I'm going to say enforced, but suggested and important. So starting in 2025, these Advantage enrollees will receive a personalized mailing from the carrier between the end of June and the end of July. And this notification is really about their unused benefits. The carriers offer these benefits, vision, dental, hearing, and the percentage of people that use them is incredibly low. And the truth is that the government actually pays these carriers extra money to offer these benefits, and then they're not promoting them enough and people aren't using them enough. So they actually wind up winning in the lack of use. So if it's not utilized in the first 6 months, there is a letter that is being required to be sent in 2025 to the Advantage plan users to make sure they know that these plans have these benefits and they're encouraging their use. This is huge. 10 to 15% of people use these benefits. We remind people all the time, they're often not using it. They feel like it's administratively challenging, but it really isn't, and the benefit is real. So it's encouraging these beneficiaries to make the full use of their plan before the end of the year. And for those of you on your Med Advantage plans now, please take advantage of your benefits. You still have almost 3 months to use them. But their aim is to reduce the unspent funds that are actually being directed to marketing efforts instead of providing the services. So it's not working the way it was supposed to. But a survey in 2024 found that 3 out of 10 Medicare recipients didn't use any of the available supplemental benefits. And I would contend that 8 or 9 out of 10 didn't use them all to the max. But dental coverage, and I'll talk more about that in a little bit, but reducing the dental coverage is occurring, but they can't take it away. It's too important to take it away, but they are going to reduce it, and they may switch to preventative only, which is very different than comprehensive care. Back to Medigap for a moment. Medigap plans cover most of what Medicare doesn't pay. They're simple. There's the most freedom. They're standard nationally, and they're easy to understand. It's certainly the preferred choice for the more affluent consumers where premiums aren't an issue. They're designated by letters, N, G, F. There's a high deductible G, but the range in price is dramatic, depending on what part of the country you live in. $75 up to $400 per person per month. But again, they're standardized. What one has to be looking at is the renewal rates over time. There's a carrier that has pulled out of New York. It's pulled out of a number of other states. Their rates are going sky high, and we're trying to encourage people to go to a carrier that has more regular rate increases. And if they pull out of an area, it means they just simply can't afford to cover that. They're going to continue in most cases to cover the people, but the rates are going to go up higher. Customer service, of course, is important. We know how important that is, not just from the work we do, but from when people actually wind up calling the carrier. And that's what affects star ratings. Star ratings is sort of goes from 1 to 5. There are there's no 5-star rating in the Northeast, but there are some 5-star companies around the country. And that means they're just excellent service. Their pre-authorizations, everything that occurs, they are stellar. But in these plans, you can visit any doctor or hospital anywhere in the country that accepts Medicare. That's 95% of all doctors. So it's the maximum flexibility, minimum friction. There's no question about it. But it does not include a drug coverage. So that is additional. Speaking of drug coverage, these are the big changes that are going on that has created a lot of downstream impact. So there's a lot of sensitivity. I spent a lot of time on a phone call today with someone trying to understand the pricing for 2024 and then changing for 2025, whether they actually have medications for the rest of the year, so that we can give them a lower price plan for 2024 as we move into 2025. In most cases, premiums have gone up for prescription drug plans in 2025, but there are co-payments. Some cases, the co-payments have been zero. Co-payments can go up to $1, and for the insurance companies, that's a big deal. But 2024 had 4 stages of coverage: the deductible after deductible, what used to be called the donut hole, and then catastrophic. In 2024, catastrophic was $8,000 maximum. It is now going down to $2,000, folks. It's the biggest impact in Medicare as a whole in almost 20 years. But every year the formularies change a little bit. Some medications may change tiers. Some medications, not many, actually get pulled and are not covered. So when we run these prescription drug plans, we are looking at all factors, but they do change yearly. And it also changes based on whether you go to a preferred pharmacy, a standard pharmacy, or a mail order. Shockingly different pricing. People are very used to what they're used to, and they're very comfortable, and it's human nature to stay with the pharmacy, for instance, that you've been using. But that doesn't mean it's the best price. In some cases, and I'm a real proponent of independent pharmacies, they're getting squeezed all the time, but there could be one particular medication that the independent pharmacy doesn't price out as well as one of the chains. So for everything, you go to the independent. For the others, you go to the brand named, the box store locations. But it needs to be looked at. Again, the reports that we run, I'll show you in a moment, show you the difference in price between pharmacies. But there are other options for prescription drugs. There's GoodRx, there's Single Care. GoodRx is probably the more common of the two. It's off of plan. All of these things that I'm talking to you about, GoodRx, Single Care, Mark Cuban, and Amazon, are off the Part D. So if you're going to get a $2,000 maximum for 2025 and you use GoodRx, it's not counting towards your $2,000. Mark Cuban, Amazon, mail order. Okay. But it's mostly generics. We've been pricing them out, and we haven't been particularly impressed by what it is that they're pricing it at. So again, in some cases, people are saying, I don't need a prescription drug plan. We feel that's risky because if you don't get a Part D plan, you don't have a Part D plan, then years later, when you actually want to get one, you'll actually be penalized. And so that's not something that anyone wants to sort of have as a penalty. But the premiums are going up, and people need to make their own decision on that particular area. We, of course, always recommend having a prescription drug plan because you never want to pay retail. So the pricing, the reason why pricing has changed, is the liability for these drug manufacturers has increased from 20% to nearly 60%. I've spoken recently to some of the independent pharmacies in my area, and they are very concerned about the payment structure that they're getting in general. And they're not sure what 2025 is going to look like. But it is that $2,000 limit on drugs, not the premium. On the Advantage plans, there's no premium for the prescription drugs. On the Medigap plans, where you have a standalone plan, let's say that depending on where you are, the premium could be $5, it could be $60, but that's not included in the $2,000 limit. But in addition to this, what further complicates everything is that the medications are now available that you pay for at the counter. A payment plan is being introduced. So which means that you can go to the carrier, the Part D carrier, and say, I want to pay my prescription drugs over 12 months. And so $2,000 divided by 12 is $166.67 a month. And so that's the maximum that somebody would have to pay out of pocket per month. The challenge for every insurance company is the possibility of bad debt, is the possibility that they will not get paid for those medications. It's not at the pharmacy. The pharmacy actually gets your copays, but that's not what fuels their profitability. It is the reimbursement from the Part D carrier. So this impact is being felt in all layers of this industry. There's what's called a PDM, a pharmacy data management. Some of you may have seen this report on 60 Minutes. They are the intermediary between the drug manufacturers and the ones who are distributing them at the counter. They are taking a big amount of money out of the payments, and that's affecting profitability. And so that's changing everything. But I have to tell you, WellCare is a company that does not have United States customer support, but it is currently, in many cases in the country, the lowest standalone Part D pricing plan that exists. Again, people have been disappointed with their customer service. There's other plans that are $2 or $3 higher, but WellCare happens to be and has been the lowest and has gotten a tremendous amount of market share. So I mentioned this earlier, but these are some of the pricing resources. GoodRx, solid company, right? They have discounts on generics and some brands, but there's a place called the Canadian Med Store, which I have fully vetted out, and they're at a lot of conferences that I go to. And they're a Florida-based company that has drug medications available at competitive prices. Again, this does not go towards your Part D $2,000. Cost Plus, Mark Cuban, Amazon, okay? Needy Meds is a nonprofit organization with information on things like grant programs and prescription assistance programs. These are important things that we do for our clients to truly save money. So here we have 2025. This WellCare plan on your left, this happens to be New York. The plan, this exact plan, was $3.70 in 2024. You see the price is now much higher than that. This is shocking to us and shocking to the clients who have gotten the notices. We are doing everything we can. You see that the next best plan for these three medications is Cigna. And then there's a plan for SilverScript. Well, you can see that premium, but you can also see that the cost of these medications plus the premium is much higher on the SilverScript. But one has to look at one specific situation. One has to give us their doctors, their medications, their frequency, their dosage, and their pharmacies. And this way we do the work. We do the work and we help people make this decision. On an Advantage plan, there's no premium here, but there's still a listing of the cost by pharmacy. So this was 2024. You can see $3.70. You can see on the New Jersey side, 0 premium. So you can also see that on SilverScript, Walgreens is $1,000. WellCare is $44. Okay, this is the variety and variability that occurs within this marketplace, which is why we encourage people all the time to review their plans to make sure that they know what prices are being felt into the new year. Right now, believe it or not, we thought we'd have all the information we need for everyone to be informed. They are still changing their prices. We can't sign anyone up till October 15th. The prices are still changing when we're going into the system and trying to find out what the best plans are. So any of you who are waiting for us to give you information, things are still changing for us. And we expect it to be solid by October 15th. So changes in pricing, it's all because of the Inflation Reduction Act. Every Medicare beneficiary is somewhat affected by this Inflation Reduction Act, but the most significant changes are surrounding the Part D. Also, in the past 20 years, these Medigap plans have increased an average of 4 to 6%. Going forward, in some parts of the country, they are actually going up between 9 and 13%. So it's really important to look at your Medigap pricing going into the new year also to see if you can change, and if you can change, is there a carrier that's better? Some Medigap plans in some states change by the date in which you enrolled, some by your birth date, some by year end. And so these changes occur. You get notifications often, actually, before we do. So Aetna, strong carrier, national carrier. But because of these changes and their belief that they have to make sure they're profitable, they are expecting to lose 10% of their Medicare Advantage business. For that carrier and other carriers, again, Humana's having trouble as upstate New York. United Healthcare has gone from 4 plans to 1. In many cases, I have other brokers that I know who have over 200 clients who are having their plans terminated, and they have to find a new plan. The end of December, that plan is gone. So this is a huge impact. And again, chaos is the word. We're working with everyone to make sure they're in a plan in time. Again, December 7th is the deadline. United Healthcare has been the most consistent and steadiest, but Aetna has been very reliable. But some carriers get aggressive, and then they have to pull back a little bit, depending on how much utilization they have. And so that's really what they're all doing. On the other hand, there are carriers that are coming to the New York market, that are coming to places all across the area, all across the country, that do what we call bait and switch. They come in at a low price. They don't have a lot of history. People see that they're saving maybe $20, $40 a month per person. And then 3 years later, when they've got you, they will raise the prices and they'll catch up for lost revenue. So when we look at Medigap plans, we look at the steadiness and the consistency of their year-to-year increases. But Med Advantage plans are looking to improve their benefit design to actually meet the needs. Again, people aren't using their benefits. If they're not using their benefits, then the carriers feel empowered to reduce them or eliminate them. But a lot of these plans, there are carriers that had 6, 8 plans in a county. It's very hard to differentiate these. But because of all that I've shared already, you can tell that the carriers are wrestling with solvency. They don't know what's going to happen in 2025. And it's going to take at least until 2026 before things flush out. Some people would say it's going to take longer. Again, a lot of the prescription drug costs that have been negotiated are actually for 2026. So again, bad debt is an issue. The cost for healthcare in general has gone up in general. So, I put this in here because people are always asking very similar questions. Does my Medicare cover dental, vision, or hearing? Well, the Advantage plans don't, but Original Medicare does not. We've talked about the difference between Advantage and Supplement or Medigap. They're important differences to understand for your purposes. How will this new payment plan work for drug costs? Well, you can opt into this monthly plan to spread out your prescription drugs. That's what you can do, and it will help a lot of people because there were times when people went in and they had to shell out $800 in the first month because of their deductible and the cost of their meds. So they're able to spread it out. So after reaching the cap, you don't pay any out of pocket for the remainder of the year, except for your premiums if you're on a standalone. So will the Advantage plans change in 2025? I think you know the answer to that is yes. So it's crucial to review the changes. If I go to another state, again, call us. Do I need to renew my Medicare coverage each year? The answer is, if you're happy with your plan, you've reviewed your annual notice of change, or you've talked to us, you don't have to do anything. It will automatically renew. And the truth is carriers, more than anything else, expect you just to renew because people, again, human nature, they stay the course. But it's important to review the plan to make sure it meets your needs. How often can I change my plan? Again, October 15th through December 7th. Again, if you're retiring, right, you can do it any time of the year. But if you've got a Medicare plan and you're on this call, then you can make this change only between October 15th and December 7th. And then there's that small window from January 1st to till March 31st that gives you yet a small little window that's an option. How can I find out if my Medicare medication is covered? Well, it's the formulary. It is online. Contact your Part D provider or call us, right? Why do I need a Part D plan if I don't take any medications? Well, the truth is you will get a penalty. Now it's about $4 a month for the rest of your life. If it's 2 years, it's $8 a month. That's on the average, but it's something that nobody wants as a penalty. But I do know that the cost of these premiums are going up, but I still think it's risky. All right, benefit trends. Gym membership. People love their gym membership or they don't need it, but things have really changed during COVID. The gym membership has gone down. So they're really looking at other home-based personal fitness, whether it's Peloton or it's pickleball or it's bowling. People actually, you're doing other things. And so these carriers are really encouraging other activity to keep healthy. At the end of the day, it's about outcomes. All the carriers want is for you to stay healthy, to do all you can to be healthy, to take your medications, to see your primary care, to go to those specialists that will help you with your care. Healthcare in America is a challenge. Getting appointments are a challenge. But this particular gym membership piece really is an ancillary benefit. And there are 3 actual groups that actually do it. Renew Active is just by United Healthcare. That's their name. Silver Sneakers has a good portion of the market, and a new carrier called Silver and Fit is another option. And if you looked at any one of these websites, you can look at your zip code and you can see which of your gyms might be covered. So some consumer trends here, folks. 24% of beneficiaries are using Medicare.gov. That's what we use. Okay, is the most reliable and up to date to check pricing and increases from 2024 to now. 30% of all Medicare clients are hospitalized to some extent each year. The carriers want to do everything they can to have you avoid hospitalization, which is why they call you. They call you to touch base with you. They want to visit you. They want to make sure that you're doing what you can. You're taking your medications. You're being healthy. But this is their largest expense, is hospitalization. About 2.5 million Medicare enrollees pass away each year. 74% of Advantage plan holders have a zero premium plan. If an Advantage plan changes their premiums or their copays by just $5, not only does it have a big impact on the consumers, but it has a big impact on the carriers. And that's the kind of change you're going to see. So 80% of people who enroll in Medicare, first-time enrollees, do so on their own without a broker. But 70% of the enrollees worry they will get this decision wrong. So what is going to happen to improve the Medicare landscape? Some of these things I've mentioned before. They're really looking to clean up this industry. There's a lot of bad actors in this industry. We have to fight that tide all the time. We want to ensure seniors that they are being serviced better by working with a broker. The leads, when you go online and you put your name in for any website around Medicare, that lead is sold to 6, 8 different companies. That's what's looking to be changed, to have it go to just one. There's so many pieces of mail that come. They're really looking to discourage the bad actors, but also the anti-competitive practices that occur. There's frustration in enrollment process, but also, as I said earlier, reduce the number of Advantage plan options so that people just have maybe 3 choices, and let them be enough different that they're not that similar, but they need to be simplified. I mentioned star ratings earlier. These star ratings are important. 3.5 is good, 4 is better. The truth is that if they get a 4 rating, they are getting a lot of extra money from the government to be a 4-star. If they're getting a 4-star, they are dealing great with customer service, managing complaints, managing chronic conditions, responsiveness. That's what helps customer satisfaction. That's what happens with star ratings. A lot of the star ratings have dipped, and the carriers are doing everything they can to increase their star ratings. Extra help, low income subsidy. These are people, I mentioned it earlier, this has changed from 2023 and 4, is that for somebody who's low income, again, extra help, couple 30,600, single 22,600. People who have that low of an income can have extra help with deductibles, with premiums, and fixed lower copays for certain medications. Dental. I'm a huge proponent of dental coverage. I use it all the time. People say, is it critical or is it non-essential? But I know many dentists, and you really can't be healthy without sound oral health. The interesting thing about coverage was introduced in 1960, but the maximums haven't changed much since then. They're maximums of $1,000, $2,000. That's not a lot. But poor oral health affects physical and mental well-being. People who don't have good teeth are less social. People who can't hear are less social. And so getting care of your dental life is important. But also dentists often detect things like diabetes, cancer, heart disease, and dementia earlier than the regular doctors do. So some statistics. 1 in 6 adults, 65 and over, have untreated tooth decay. 2/3 have gum disease. 1 in 5 adults have delayed or skipped dental care in the last 2 years. 47%, no coverage over 65. ER visits for preventable oral health issues have surged, but many states have excess dental capacity for expansion. So what do people say? 77% of the people say they plan to visit a dentist next year. 37% of the people actually visited it. What is the reason? It's the cost, okay? The cost is not free unless you're doing just cleanings, x-rays, or fillings. So there's a higher proportion of costs that are coming out of pocket, okay? 1 in 5 beneficiaries who have used dental services spent more than $1,000. 11% spent over $2,000. but cost is the top reason. You can get an in-house discount plan from your dentist. Could be $200-300 a year. You get it, you're paying it up front. And if in fact you use services beyond that $200-300, they say they will give you a discount. Well, in fact, the range of costs for a dentist isn't the same as setting them in Medicare. You can get a root canal for $500, you can get a root canal for $1,000. 10 to 30% discount off of what is the question. The dental plans that are available help a little bit more than these in-house plans. So if you do want 3 to 4 cleanings a year, you actually have to have it coded as periodontic. So just a little bit more about dental. The Advantage plans, they don't have the same dental coverage all across the board. Standalone plans vary widely. You can get a $35 plan up to a $90 plan. That $90 plan could cover you up to $5,000. It's okay to ask your dentist for a cash discount. Dentists can actually also control your expenses. They could say, let's do something in 2024, and if you have coverage, let's push some of it to 2025 so you don't have to come out of pocket as much. But also people who are leaving their job, and I encourage people to look into this, they may be able to actually keep their dental through COBRA for a year and a half, in some cases up to 3 years. But they should really look at the details of the coverage. Is it 1,000 max? But most of them, their dentist is covered by this plan, and it's often easier. But of course, that's one of the services that we provide. For those people who have HSA money, which is tax-free health savings account money, it certainly helps often with dental costs, that people love their HSA. So talk to your dentist about, about helping you save money. These are expensive services, but again, my suggestion is not to skip the dental visits because you're worried about the cost. The short-term savings can truly lead to health problems later. Okay, these are dental benefits. If you look at the right part of the screen, the major comprehensive services, people over 65 are often using them. All of these are at 50% for almost every plan you have or have ever had. Preventative, often zero. And when people are just doing those routine exams, then they're really not coming out of pocket. But for the major plan, the major work is often at 50% coverage. So this is just a little screen on the Affordable Care Act. We don't actually do the Affordable Care Act, but I wanted to point this out because I think it's important for people who may be on the phone who are actually have family members under age 65 that still need coverage after maybe someone else goes on to Medicare. You could see the range of prices, but if you really look at it, you're looking at annual deductibles. You're looking at an annual deductible that varies, and that's where the cost of the premium changes. So whether it's a $2,000, $3,000, $10,000 deductible or out-of-pocket maximum, that's where the price. So it goes from $531 to $872. This was actually for my niece in Massachusetts that I helped her make a decision, and I believe she took a middle plan. But the plan varies a lot. It's 50% more expensive for a low deductible plan. But somebody who's 63 years old is going to be higher because they're older. And so these Affordable Care Act plans, again, we have a resource for this, and I certainly help people review these plans, but we don't actually work in that marketplace. The dual special needs plans. These plans are both Medicare and Medicaid. For those people who actually are on both of those, it certainly gives additional benefits. Again, if you think about the healthcare company, they want these people to have positive outcomes. 60% of all these low-income people, poverty or racism, they are needing care. They need a care coordinator. They need guidance on prescription utilization. There is assistance. There's healthy food. They're over the counter. If the carriers can save money on these kinds of patients, it actually saves money for all of us. So there are over-the-counter, there's pet supplies, there's transportation, there's utilities. Some of them even have rent and mortgage assistance. So these benefits are enormous, but clearly not that many people qualify for both Medicaid, especially, or Medicare. So a couple of other things, and I think I've got about 20 minutes left. So again, I thank you all for attending, and I don't know how many of you are asking Michelle questions, but I hope you are. So Medicare, how does Medicare cover at home for Alzheimer's patients, but only if they're homebound? So Medicare will cover some of this. It'll cover safety evaluations, cognitive assessments, care planning, hospital stays, and prescription drugs. And there's something later on that I'll talk about around Alzheimer's patients. But home health care, again, a question that people ask. You'll certainly get more home health care if you have long-term care insurance, but even people on Medicare, they'll get 8 hours a day, part-time, skilled nursing, physical, occupational, speech therapy, medical supplies, some home health aid services. But most home health agencies will accept people with Medicare, but they won't necessarily accept them if they can't accommodate their medical needs. So not all agencies are the same that can handle all kinds of care. So to receive Medicare coverage for a caregiver, right, the following criteria must be in place. The patient has to be enrolled in Medicare. The services have to be medically necessary. The caregiver must meet Medicare requirements. In this case, family members and friends are excluded. So the caregiver must be a part of the Medicare system, and the doctor will need to create the plan that explains how the caregiver assists the patient's health. So caregivers that provide sort of additional services can receive more pay, but they have to be approved. And again, you would think and know that caregiving is often handled really on a case-by-case scenario. This is a brand new company out there called RubyWell. This is for the underutilized aspects and needs of home health aides. This is about paying family caregivers a living wage. This is brand new, and I am so excited to be able to share this because there is a labor force out there that's untapped, and it's a source of revenue for these family caregivers. And so what this is about, this is a program that allows people who are, and this is the key, and on the very bottom, I want to point you to that. This is a settlement that occurred that changes the belief that the Medicare program covers nursing and therapy services under the benefits only when a beneficiary is expecting to improve. So what this is about is serving people with ongoing, debilitating, or chronic conditions that can benefit from services, but may not improve or improve quickly. Now, that is against what has been spoken of in the marketplace for decades, because Medicare actually authorizes up to 28 to 35 hours of home health services, contrary to what people are often told by providers. So what is the the criteria for this? It requires a physician plan of care, part-time nursing therapy, but the misconception is that home health coverage is available for chronic conditions and long-term care, not just short-term recovery. So the settlement clarified that Medicare covers care even if the patient isn't improving. They're focused on maintenance and preventing deterioration. So home health agency often underutilize this. They're missing out on the care improvements and potential revenue. Now, the reason why these programs are not being used that much is because Medicare doesn't necessarily want to pay for it, okay? But this was a lawsuit that was filed, and it was determined that it is true. But what has to happen is the individuals have to be trained. And so there's a class that they need to go through. And once they're trained, they can get paid by Medicare. This program here is for dementia folks. It's called GUIDE, okay? This is a program for respite care. Starting in 2025, it's being put in place to support dementia patients and their unpaid caregivers. And because it's going to quadruple in 2025, expanding to regions all across the country. The respite care is up to $2,500 annually for at-home care, overnight stays, or adult daycare services. But the eligible criteria, of course, there has to be some participants must be enrolled in the original Medicare. They have to have a dementia diagnosis. They can't be in hospice or residing in a nursing home. Patients and caregivers won't have to pay co-payments for these services. This is brand new. So training for caregivers. Again, there's a lot of emphasis on trying to keep people at home with the people they care about so that they can get the kind of care they need without going to a facility, a nursing home, or someplace else. So there are new changes to provide family caregivers with the training from the medical professionals to better handle the needs of the loved ones. So the CMS is willing to pay these Medicare providers to train the family caregivers. And this includes nurse practitioners, physicians, physician assistants. The training in both groups and individuals will begin in 2025. So as many changes I've made, that doesn't sound good. There are some positive changes. This is, of course, something that's important to many people, the weight loss drugs. These drugs, Ozempic and Mounjaro, again, there was a congressional hearing recently on these. And of course, these medications are 1/10 the price in almost every place around the world. And it's these PDMs, these pharmacy data management companies, who are really impacting this in a big way. But when they're prescribed for Part D, type 2 diabetes, that's one thing. But what's changing is that they're looking, and they have found research that it impacts people with cardiovascular disease. So they couldn't make the change in the middle of 2024. So because it was the middle of the year, but people who might be able to benefit from this, plus the $2,000 cap, which may, in fact, if the doctor's approving it and if the carrier's approving it for the individual, may significantly change the use of this. These medications are being utilized. The manufacturer can barely keep up. But FDA, if they approve it for other conditions like sleep apnea, Part D plans may cover it for these purposes also. So this is, there's truly, folks, there's no one else in the industry who's giving this kind of information. I can't tell you how much research I've done and the work of my team to help me put together these slides. Access to mental health services. Another thing that's positively changing. They're looking to add counselors and therapists who treat at least 20 patients in the last 12 months, okay? There's a lot of what's called ghost networks that really don't even exist, but they're looking to add 400,000 clinicians nationwide to get them onto the Medicare rolls, okay? This is really helpful. People want mental health. I'm often asked if a mental health provider is covered by the Advantage plans or Medicare, and too often the answer is no. And so there's a real push to add clinicians. And again, you need to verify with your provider whether they do accept Medicare. But they want to increase participation, but they have to apply. So you have to look at that. The other thing is telehealth. Even though telehealth has become sort of an accepted model, some of the expansions have actually expired at the end of 2024. But they have permanently expanded access to telemedicine for behavioral health. Again, especially helpful in rural areas with limited provider access. Technology and artificial intelligence. Like every industry, brokers are looking at how artificial intelligence can help in many ways. But here are some of the artificial intelligence things that Emerald Medicare is looking at now and in the future. I write a lot, and so yeah, some of the blogs that I write. We're taking advantage of some of that, and I'm editing it and really making sure I get out there in the marketplace. But we're piloting right now. Actually, we started this today. We're starting to do standalone prescription drug runs through artificial intelligence. We are very excited about it. It's going to save our team, and it's going to be able to be input by the individual and the person who has the medications and update it. Ultimately, they'll be able to do medication management. They'll be able to suggest alternatives to certain medications. We are really essentially the only company in the country who's experimenting and piloting this program. We're very excited, but we're also cautious. We have a backup plan, but we have for years and years run thousands of prescription drug plans. And so we're looking to get accurate information to help our clients quicker than they've ever gotten it before. So right now we have easily 300 or so prescription drug runs that we're waiting till all numbers get final. But with the benefit of entering in your medications, it is so quick to get these prescription drug runs to you and to help you decide whether you should stay the course or make a change for the new year. So some of the data that we have, certainly some of the document submission, administrative pieces, we're looking at all of this. We have almost 2,000 clients. We are really working hard to manage and support all of them. We do our best to answer the phone calls as quickly as we can, and we get back to people if we can't. So as you look at 2025, it's important to make informed decisions to suit your health and your financial needs. We're in open enrollment. There are significant changes taking effect. I've talked about them at length, but it's crucial to review and compare your plans during this period. There may be new plans. Your plan may be eliminated. Based on your situation, your health, your doctors, your meds, there may be a need to review it. Again, I know that inertia doesn't allow people often to make a change. Trusting people and trusting whether it's us as your broker or anyone else, that's what trust is about, is knowing we're going to do what's in your best interest. But if you did get an annual notice of change, look at it. It was sent out in September. In some cases, it went out the last day of September. But this will detail any changes that are in place for either your Advantage plan or your prescription drug plan. The Medigap companies do not have to send out an annual notice of change because actually the plans change very little. What changes is the premium, and they do send notification at the various times of the year when those changes do occur. But compare your plans thoroughly. Don't rely strictly on the premiums. Lower premiums may mean higher pocket expenses. It may mean fewer benefits or not as good or strong coverage for your medications. Compare deductibles. Look at your copays, your medical costs, in-network and out-of-network providers. If you're on an Advantage plan, make sure your doctors are covered. Again, on the Medigap plans, 95% of all doctors are covered, but clearly there are doctors who do not accept Medicare. CMS is focused on industry challenge. Their challenges. They really want to provide ethical practices too, and they want to make sure they address the bad behavior. And there's plenty of it. There's call centers that are just there to sell you. There are people who are calling, your loved ones and convincing them that with a little bit of dental or a little bit of vision, they should make a change. They should be consulting somebody who is an independent broker. But we look at the long-term value of you as a client, the loyalty, the referrals that we get from you. But people are skeptical about change. We feel like we are totally transparent in all the issues that are coming about. Again, this presentation is a labor of love and a labor of commitment from a conference that I went to in April. And I've been speaking about these changes and continue to enhance these presentations as time goes on. I'm doing another one in November, maybe with new updates, maybe not. But it's important to have unbiased, independent relationships. Our individualized support. Carriers are resetting their pricing. It is more important than ever to find personalized guidance and education for your specific needs and circumstances. You need to find a trusted resource that should exhibit ethical behavior and transparency, review your costs and determine best options during open enrollment and throughout the year. Our team gets calls all through the year on questions, whether it be billing issues, carrier-related issues, or new prescription drugs. But reviewing drug costs and alternative options, right? That's what you need to look at, because formularies do change, and you can tell how big an impact this is having. The Inflation Reduction Act. Look for clear, objective, and unbiased advice. I hope this has been a good education, but we also provide other senior resources, case managers, geriatric managers, all kinds of people who support seniors. These are the kinds of professionals that I work with, and they work with me. It is important so that you take care of yourselves, take care of your loved ones. Our mission is to support you in all these ways. We give you the guidance, we're unbiased. We'll do in person, I'll do virtual. You can invite me anywhere to talk all year long. I talk to an over 55 community in Carmel, New York. I was in Connecticut, I was in Massachusetts, I was in Pennsylvania. I will go where people are who really want to learn about this. But this is the time of the year. This is open enrollment. This is their chance. Utilize the tools and resources so that you can equip, for those of you who are professionals with seniors, give them the tools, find the tools to help your clients to understand their plan and to make sure they have the right decision going forward. We are a very friendly team. We are experienced and we're knowledgeable. I am proud of my team and I have trained them well. And our services are no cost at any time. We are paid by the insurance company, whatever you decide. There are people who call me and they call me again in 3 or 4 years because they're not ready to retire. We are truly all about servicing. So just a couple of updates. The Part B premium, well, what is currently for the lowest for income under 103 or under 206, 174.70. That's what you're paying out of your Social Security check or on a monthly basis. It's going up. The Part D deductible, $545, going up. The Part B deductible, $240, going up. The maximum out of pocket, $88.50 on the Advantage plans, going up. So 2025 is new numbers. But recognize the importance of knowing your plan's costs, potential costs, and understand the importance of healthcare costs and financial planning. I work with a lot of financial planners, and they are utilizing the services that we provide to help their clients understand what the cost might be in premiums and deductibles and prescription drug costs. We always speak of advocating and appealing. Sometimes you get bills that are wrong. Sometimes you get things denied. Advocate and appeal. It's a lot of work. It's time consuming. I know people who have appealed 4 times and won, but it's important to appeal because some of these insurance companies are in business to deny the first claim. Don't give up. Seek objective information. This is the time of the year, October 15th through December 7th. Decisions are at age 65 or retirement or at annual enrollment, but review your doctors and meds, especially chronic conditions or special needs. Understand Advantage. Understand Medigap plans. Just understand what they are and what it is that you have a choice to do. Medicaid and Medicare, those are dual plans for those who know people who are on it. There's a lot of advantages, but find a trusted resource, whoever it may be. So that's my wonderful team. I'm sorry for the scratch marks that came onto the presentation. I don't know how they got there. So I hope it didn't distract very much from the presentation. I have finished right on time. I can't believe it. So I hope this was valuable. I am so proud of my team, so proud of the work that we do. Coming into this season, we are ready for all of you. If we don't get back to you right away, know that we will. And we're working more hours, and we're here to help. So I want to thank you all for participating here, and tell your friends, tell your neighbors, tell your colleagues. And again, thank you very much. Be well, be safe. Bye now.